So this is very, very important concept of deiodinations. Now, after this, what is going to happen to T3 and T4? This T3 and T4, what is going to, it will diffuse to out, okay, this is a T3, and let's say this T4. It will diffuse out to the interstitium and to the circulations. Now the T3 and T4 is here, okay? This is what it is. And as I said, T3 is produced much more or less compared to T4, okay? And we'll talk about, and next we'll talk about the transporters of this, okay? But now, quickly what I have to do is I have to discuss about, okay, what is going on here, okay? We talked about a lot of different stuff here. Now, as I said, okay, this, okay, how much T3 and T4s are so-called, required, okay, in your other cells, that is completely controlled by your TSH hormone. Remember, the TSH hormone works on, look, and here, okay, this transporters, let's say this is a transporter. It works here, okay, that's number one, that works here, okay, because what is it? It amplifies, okay, whenever you need more, let's say, thyroid hormones, it amplifies the uptake of, or the iodine trapping, okay, by increasing the probability of this transporter. That's what thyroid stimulating hormone does, okay. Thyroid stimulating hormone also comes back here, okay, and the two here, and what it does, it works on the nucleus of the gene, okay, and start producing a lot more so-called thyroglobulin precursors, okay. That's what started doing it, okay. Thyroglobulin also comes and works on this TPO too, okay. That's a TSH, okay, thyroid stimulating hormones. It also works and comes in, what is that? It tells them to work much more faster, or amplify the speed of producing so-called thyroid hormones, okay. Thyroid hormone also comes back, okay, and works onto this TSH right here on the receptors of the maglin receptor to take how much to take, so that way, the endocytosis can occur here, okay, and then proliferations and the speed of this lysosome works, and the breaking down, okay, and then also throwing to so-called here into the circulation, okay, it also does that. And this process in which, okay, this amplifying and, the speed of taking this so-called, let's say, working onto these receptors, okay, maglin receptors, and taking all into the cells, this is so-called endocytosis, as I said, right? It's an endocytosis process, okay? And then after that, what is going to happen? It will diffuse out to your blood plasma or your extracellular fluid, okay? That is going to happen to T3 and T4, okay? That's why those TSH, the thyroid stimulating hormones, works, okay? And it's very, very important that you understand this, okay? Now, after that, we're going to talk about a couple of things here, okay? One of the things you have to talk about here is that, okay, there are certain drugs can inhibit this TPO, okay? What are those drugs, okay? That I'm not gonna go super detailed about it because you're gonna talk in pharmacology, but let's just quickly mention some of them, okay? Because if you inhibit this TPO, what is gonna happen is that you decrease the production of your thyroid hormones. Okay, that's what is gonna happen. Let's say, like some of the drugs which can inhibit there is known as propyl thiouracil. Okay, that's one of the common one that you use. Propyl thiouracil. Okay, what are they inhibits the TPO. There's also they call as a methimazole drugs. Okay, and also methimazole or propyl thiouracil that can inhibit the thyroid peroxide enzymes. If you inhibit the thyroid peroxide enzyme, what is going to happen here? You're not going to form so-called your thyroid hormones. And then if you're not going to form thyroid hormones, what is going to happen? You're not going to produce thyroid hormones. There will be less thyroid hormones. Usually, these drugs are given for the people who have hyperthyroidism. Okay, that's what's going to happen. One more thing that I have to mention here is that one other thing can also inhibit this. Okay, and that inhibitions, okay, is the iodide itself or iodine itself. What does that mean is that, okay, if you take let's say like excess amount of the iodide, okay, what they can transiently inhibit. Okay, what is this called? Okay, let's do that. It's a transient inhibitions. Okay, the transient inhibitions, because of the excess amount of this iodide molecules, can inhibit this thyroid peroxidase, okay? And if you do that, okay, transiently if you inhibit that, what is going to happen? You're going to produce less productions of your thyroid hormones, okay? And then, okay, look, But remember one more thing. So that's going to transit inhibit this thyroid hormones, and this thyroid gland. What could happen is when you are transiently inhibiting, when you're giving excess of the iodine, your thyroid hormones, it can decrease in the size. Okay, thyroid gland can get smaller. It can decrease in size. Thyroid gland can get smaller, and also there will be a so-called less perfusion, so less blood supplies is going there. The thyroid gland usually it gets smaller. Usually this is done in surgery too, okay? But these are transient inhibitions, okay? That's what it does. And then this, okay, the transient inhibitions by giving excess, so-called excess amount of TPO, they call this phenomena called, let's write down here, it's called Wolf, okay? Wolf, okay, Chaikov effect, okay? That's what they call this. Okay, that's what it's called Wolff-Chaikoff effect. Okay, transient inhibition TPO because excess your iodide. And then other one is that, let's say when you reduce that, now if you reduce that, that means the less amount is taken by this transporter, which is Na sodium iodide transporters. Okay, less taking it. That means there'll be less synthesis of this T3 and TPO. Okay, and that will result into, okay, so let's say, if you, okay, let's repeat one more time here. If you give, okay, if you reduce the, let's say now, you give too much, then after you reduce it, then what's going to happen? There'll be less uptake, then this will be not overwhelmed, and this guys also would not be overwhelmed. They will start functioning normally, and you'll have a normal productions of your thyroid hormones, okay? That is called escape, okay? You call escape Wolff-Chaikoff effect. Okay? That's what it's called. Because when you give, first you give too much, then after that you reduce it. Then after that when you reduce it, it's going to start functioning normal level. Okay? That's what called escape Wolff-Chaikoff effect. Okay? Now, so, so the point being here is that iodine induced, okay, this transient inhibition, we can call this as iodine-induced hypothyroidism, basically, that's what is happening for a short period of time. Now, anyways, now we have to understand one more thing is that, let's say, if there's a less productions of your thyroid hormones, right? Let's say, that means this T3 and T4, what's going to happen? They're going to go to circulation right here, and then they're going to work onto this, the anti-pituitary and also the, like TRH, okay? They give a feedback signals back, okay? And when they give feedback signals, what is going to happen? They start producing more TRH, and then they start secreting more TSH, okay? One more thing though. If you, let's say, if you inhibit this, okay, TPO, okay, or let's say this TPO is not working, okay, that means what's going to happen when you have, let's say, increased level of TSH. Let's say we give a proper thyroid cells, okay, for a long period of time. What is going to happen is that there is a increased level of, okay, there's a decreased level of in a plasma, T3 and T4, let's say. And that will result into a negative feedback, increase over TSH, right? These TSH will come here, okay? And what is it going to go? They're going to start working in the cells, okay? They'll increase the size of the cells, okay? They're going to increase their work on the mitochondria, they'll increase the size of the cells, okay? And then they're going to keep working, okay? They're going to keep trying to synthesize so-called the more thyroglobulins, okay? And they'll have a more, trying to take the uptake of this iodine too. But because of the deficiency of this, you're not making T3 and T4. So because of that, continuously, there is a given feedback to by T3 and T4, and then TSH is keep working onto the cells. So whenever there's overstimulations of the TSH to these cells, then that's going to result into, okay, increase in size, okay, and the shape of the cells, okay. That means, okay, whenever you increase this increase in size in several cells, what's going to happen? You're going to see enlarge of your thyroid gland, right? And whenever you see the enlargement of thyroid gland, what do we call that? We call them as a goiter, okay? And remember, goiter is, okay, goiter can be nodular or it can be smooth, okay? That is completely dependent on its etiology, okay? If it's like, if it's a thyroid cancers and it gets infiltrate, then usually you could see like a nodular, okay? But you can see smooth too, okay? But basically the goiter means the enlargement of your thyroid gland, okay? That is what's happening in here, okay? Because size and shape will become larger, so hypertrophy of the thyroid gland happens, and then enlargement of the thyroid gland is so-called as your goiter, okay? That is something that's going to happen. Now, after this, So I have to talk about some other stuff too, which is what this transporter can also, okay, this transporter also can, let's say, can get inhibited, okay, and what are the things that can this transporter can get inhibited by, okay. One of the very common one is bromide, okay, because remember, iodide is what negatively charged, so as your bromide, okay, your bromide, because they are competing for the same transporter, okay, that one. Other one is like a thiocyanate, okay, thiocyanate, all of this, bromide, thiocyanate, okay, what they can so-called this inhibit this NAIS transporter, okay, and whenever they inhibit this transporter, what is going to happen? There's a less intake of so-called your iodide molecules, okay, and remember, this iodide, if it doesn't become iodine, okay, it's not going to make, okay, it's not going to make your thyroid hormones, okay, because iodide is required to make thyroid hormones, okay, so by giving bromide or even thiocyanate, okay, what is going to happen is that, okay, you're going to have so-called, it's going to inhibit the channels. This other one is called colloid or something, okay, that is also going to work into this transporter, okay, and then basically to inhibit so-called your sodium, okay, iodide symporter, okay. This is something that you should know. Now, after this, okay, let's quickly write it down, like, okay, what should we write? Let's quickly down some of the steps here, okay? What are some of the steps that we did here, okay? Let's write it down, some of the steps, okay? So first thing we did is what? Okay, we took the uptake of the iodide trapping. That's the first thing we did, right? From the broth. Let's write down. That's the first thing to informations of your thyroid hormones. Iodide trapping, okay? That's the first thing we did. Let's write down the steps right here. What is the second step we did? And after that, once we did the iodide trapping, okay? With the TPO, what we did? Let's talk about this, okay? Okay, actually, yeah. We took it here and then we did, okay, with the TPO, okay, let's write TPO, we did so-called oxidized, okay, oxidized to form so-called your iodine. That's what we did, right? Now, third is that synthesis of your so-called your thyroglobulin, right? That's what we did here, right? Synthesis of thyroglobulin, right? 4. Organifications of so-called or iodinations of thyroglobulin. Okay, that's what we did, right? And then 5. What do we did? Okay, once we did this one, iodinations, so oxidize of your iodide, and then iodinations of your tyrosine residue, we did conjugations, okay, to form so-called your T3 and your T4. That's what we did, right? And what's the 6 steps right here? Okay, then we took some of those with the receptors, okay, with the magnum receptors, okay, magnum receptors right here, we took some of those out, and then 7, what we did? Lysosomes fused with the lysosomal fusels, okay, to cleave and break into single amino acid, MIT, okay, DIT, T3, and T4. Then 8th step, what we did? Because MIT and DIT, what is happening is going to the recycle, right? MIDIT and other amino acids, it went recycled, okay, and then it went back to the lumen, okay, here, and we talked about how it went, okay, and then 9th step is what? The T3 and T4 actually leads into circulations, okay. This thyroglobulin, okay, we label this as a thyroglobulin, okay, that's what they write down, TGB. But remember, don't get confused this one with the TBG, okay. This is thyrobinding globulins, and it's a transporter, okay. So don't get confused with this, okay. This is thyroglobulin, TGB, okay. Now, after this, okay, we're going to end it here. But in next, what we're going to do is that we're going to talk about the transporters and how does this thyroid hormones actually works into the different cells, okay. That's what we're going to discuss in the next class. Okay, but for now, this is what all I have for you guys, and I hope that I made it very, very clear to you guys. Thank you, and please don't forget to hit the subscribe for me. Thank you, and keep watching. Thank you.